The summer virus is a popular term for various viral diseases that may occur more frequently during this season. However, it is important to note that the term summer virus is not recognized by medical professionals as a specific disease. Symptoms may vary depending on the viral condition, but some common characteristics may include fever, malaise, headache, nasal congestion, cough, sore throat, nausea or vomiting, diarrhea. Since the term encompasses different conditions, the treatment will vary depending on the presented symptoms and the severity of the illness. In general, it is important to rest, stay hydrated, and use medications to alleviate symptoms, such as analgesics and antipyretics for fever and pain, nasal decongestants for nasal congestion, among others. However, it is important to emphasize that an accurate diagnosis of the viral condition and the prescription of specific medications should be carried out by a healthcare professional, such as a doctor. If you are experiencing persistent or severe symptoms, it is important to seek medical help to receive appropriate treatment. Rhinitis, is an inflammatory condition that affects the nasal mucosa, causing symptoms such as nasal congestion, runny nose, itching, frequent sneezing, and occasionally loss of smell. It is one of the most common respiratory diseases and can be classified into two main types. 1. Allergic rhinitis. It is caused by an allergic reaction to substances that trigger an immune response in the body, such as dust mites, pollen, mold, animal dander, or certain foods. It can be seasonal, when symptoms occur only during specific times of the year, such as spring due to pollen in the air, or perennial, when symptoms are constant throughout the year due to continuous exposure to allergens. 2. Non-allergic rhinitis. In this case, the inflammation of the nasal mucosa is caused by other conditions, such as weather changes, exposure to irritants, such as cigarette smoke, chemicals, or viral infections. Non-allergic rhinitis can be temporary or chronic. The treatment of rhinitis generally involves measures to control symptoms, such as avoiding exposure to known allergens or irritants, using medications such as antihistamines, nasal corticosteroids, and decongestants, using nasal irrigation techniques, such as saline nasal rinses. It is important to consult a doctor for an accurate diagnosis and to receive appropriate guidance on the treatment of rhinitis. Sinusitis is an inflammatory condition of the paranasal sinuses, which are bony cavities located in the skull and around the nose. The paranasal sinuses are responsible for producing mucus, which helps to warm and humidify the air we breathe. When the sinuses become inflamed due to an infection, allergy, or other conditions, sinusitis occurs. There are different types of sinusitis, including 1. Acute sinusitis. It is a temporary inflammation of the paranasal sinuses, usually caused by a viral or bacterial infection. Symptoms may include thick, yellowish, or greenish nasal discharge, nasal congestion, facial pain, headache, fever, and a feeling of pressure in the paranasal sinuses. 2. Chronic sinusitis. It is a prolonged inflammation of the paranasal sinuses that lasts for more than 12 weeks. It can be caused by a persistent infection, allergies, deviated septum, or nasal polyps. Symptoms of chronic sinusitis are similar to acute sinusitis but may be less severe. The treatment of sinusitis depends on the cause and severity of symptoms. Some treatment options may include use of pain relievers or decongestants to alleviate symptoms, use of nasal corticosteroids to reduce inflammation, prescription of antibiotics if the cause is a bacterial infection, nasal irrigation with saline solutions to help clean the paranasal sinuses. In more severe or persistent cases, endoscopic surgery may be necessary to remove nasal blockages or correct structural problems. It is important to seek a doctor for an accurate diagnosis and to receive proper treatment for sinusitis.